Periodontal disease starts mostly in the late 30s and early 40s in most people, but there are cases where juvenile periodontitis also exists in younger adults. Average patient's age, I would say, is in the 40s. It is the disease of the supporting structures of the teeth, which is the gum and bone, and it's mainly caused by the bacteria that grow in the mouth. There are several reasons for it. Mainly genetics, meaning some people are more prone to it because of the way their body is not able to fight the bacteria, but there's also local factors such as how well you take care of your mouth, oral home care, flossing, toothbrushing. Also the way your teeth are lined up orthodontically. If there's a lot of crowding, that could cause more buildup and not be able to floss readily. Also diet, how often you snack, all of these can play a part in how people develop periodontal disease. So our job as a periodontist is to try to remove these bacteria as best as we can, and also teach patients how well they can remove the bacteria at home by flossing and toothbrushing and coming to the office regularly every 3 to 6 months for periodontal maintenance. What we do is both non-surgical and surgical treatments. Non-surgical treatment basically means that we clean under the gums by doing what's called scaling and root planing, which is a form of deep cleaning of the gums. And then if the patient has more advanced cases of periodontal disease where the bacteria are further embedded into the what we call gum pockets, then we do surgical treatments, which involves local anesthesia and peeling back the gum areas of the diseased tooth and removing the bacteria and accretions from the root surfaces. And then many times we can also try to regenerate the bone that was lost by doing what's called bone grafting, or simply just debridement, cleaning, and suturing back and stitching the gums back together and allowing the healing to take place. In certain cases where the tooth is too far advanced with the gum disease and it's got too much looseness, mobility we call it, then we opt to remove the tooth, which we call extractions, and then after a few months of healing, which involves probably also some bone grafting in its socket, we place dental implants. Most periodontists nowadays do that because it has become part of the criteria for being a periodontist. So we place a titanium implant, which acts like the root of a tooth, and it's eventually after 3 months it's integrated into the jawbone, and then after that you can either refer the patient to their general dentist, or any restorative dentist will make a crown for that implant, and that will be to replace the tooth that was lost. This is in lieu of what used to be bridge work, which we had to use the adjacent teeth to the empty space where the tooth is missing, and we had to shave the adjacent teeth down. But now we don't have to do that, and you can actually have a lone standing tooth where you can floss around it and you don't have to try to pick underneath where a bridge was. My name is Dr. Ali Hedayti. I'm originally from Middle East. I came to this country in 1978. I went to college in Boulder, Colorado. I got a degree bachelor's degree in molecular biology, and then I came to New York City, and I was in NYU Dental School for about 7 years, 4 years of general dental education. After DDS degree, I did 1 year general residency, and then 2 years for periodontics residency. I graduated NYU periodontics residency in 1989, and I've been in practice since 1990 as a periodontist. Well, being a restorative and surgical dentist is very satisfactory because you have people who are either in pain or are missing teeth or are not able to enjoy their food or cannot smile, and by correcting their problems, either by removing the infected teeth or helping them with any fashion surgically to correct their problem. You bring the patient out of their painful episode, and that's quite rewarding as a doctor. So generally speaking, oral conditions have, in the past few years, we've found out that existing periodontal disease, if it goes untreated, can lead to many issues. In women, many miscarriages have been connected to this, and in general population, Alzheimer's and also heart conditions. Most probably the reason would be that there's bacteria that's embedded under the gums that has not been removed and treated, and it overwhelms the system by getting into the circulation of the body and causing inflammation in different variety of organs of the body. And there's definitely a correlation with heart condition in men especially. The plaque buildup in the brain has also been connected. I don't know if there's an actual biological understanding of how the periodontal bacteria can cause that, but there's definitely a correlation. They need to have a complete periodontal checkup, probing of their gum pockets to make sure there's no standing periodontal disease that went unnoticed, because gum disease is quiet disease. You don't have usually much pain with it. It's not like a cavity where the tooth starts hurting. So it can go unnoticed in most people if they don't go regularly to their dental checkups or have the gum pockets checked, have hygiene visits, and x-rays taken. So that's what's necessary, is the regular checkup. Dry mouth in particular does have a drastic effect on health of the periodontium and health of the teeth also, because the saliva is a lubricant that removes the bacteria off of our teeth and maintains somewhat the health of the gums and the teeth, aside from the fact that we have to brush and clean. So if somebody's undergoing any kind of chemotherapy, or for whatever reason their mouth is dry and the saliva is not coming out as an optimum from the glands, then they definitely gonna need to be advised to get some sort of oral rinses that are specifically made for that purpose to lubricate the mouth, and also they need to have fluoride gels placed on their teeth on a regular basis. The easiest way to correct bruxism, or at least mitigate that problem, is to have, first of all, you need an examination to see if there are signs of bruxism. But if that is correct, then you need something called a night guard, which is basically the mold is taken of the upper and lower teeth, and this appliance, which is acrylic fabricated, that you wear at night during sleep, and it cushions between your upper and lower teeth to prevent excessive pressures during your sleep time. Yeah, so firstly I teach those patients to be very gentle with the toothbrush, always use a soft bristle toothbrush, and go light so that they don't continue to cause more recession. And also there's surgical procedures that can correct that. It's what's called free gingival grafts, where we take donor sites such as the palate, remove part of the tissue from there, and suture it and graft it to the areas of recession. Pregnant mothers, or if they're planning to become pregnant, should have a dental checkup, general dental checkup, to make sure they don't have periodontal disease. But a lot of times in the second trimester, first and second trimester, a lot of women get what's called pregnancy gingivitis, which generally is hormonal and not related to bacteria. And the gums get red and inflamed and they swell up, and that can be easily fixed with some mouthwashes that are particularly made for that purpose. But they should also, I would suggest anybody who's planning to have a child to have a good thorough cleaning and prophylaxis of the mouth prior to pregnancy. Dental implants are great options for people who are either missing part of their teeth or completely lacking dentition and wearing dentures, or are suffering from advanced periodontal disease where the teeth are not don't have a good prognosis, which means in the long term they have to be pulled. So single or double or triple implants can be used to make areas, bridge work for certain areas that are partially missing teeth. And then there's procedures called all-on-4 or all-on-6, where the whole jawbone on top or lower arch, the poor teeth are removed and replaced with 4 or 6 implants, so you can have full mouth dentition back again after a couple of months of treatments. Well, we do a lot of bone grafting after extractions to make sure we maintain the volume of the jawbone properly, so that later on the implant can be placed without compromising the size of the implant and have a proper support for their teeth. Bone grafting is something that you get taught in periodontal school, perio school, and also with oral surgeons. And it's quite an important thing that's not emphasized as much in general practice, and it should be practiced more often. Yes, so when you go to a periodontist, usually they require, if it's an upper jaw issue in the back areas, the proximity of upper molars to the sinus leads to small and limited amounts of jawbone. So usually periodontists and oral surgeons both require a CT scan, and that is a tool that has to be definitely used prior to removal or planning for future for an implant, to decide if there's enough room eventually to put an implant when the tooth is removed in the upper back areas. Or there's a procedure called a sinus lift, where after the tooth is pulled or at the same time, an oral surgeon or a periodontist can increase the height of the bone on the floor of the maxillary sinus. Lengthening is a popular procedure that mainly periodontists do, and it's when you have a uneven ratio between what's left of the tooth and the amount of root that's under the bone. And if the height of the tooth that's coming out of the gum area is too short, or because of the decay the tooth is broken down, then usually a general dentist or whoever is the restorative dentist asks the periodontist for the procedure called crown lengthening, where you basically hem the gums back, lower them or apically position them, so that you can provide more surface area, so that a crown has enough retention after the gums have healed.